Patients with severe scoliosis is my most common patient I see in my office. And the reason why is because they unfortunately follow the exact prescription that their traditional doctor gives them. And they end up in a position that they're normally recommended scoliosis surgery. And then when they get that diagnosis is when they start seeking me out. And when we look at scoliosis severity, it's very broken down into very specific categories. We know mild scoliosis is anything between 10 degrees and 25 degrees. And we know the treatment option for mild scoliosis is nothing, doesn't matter if you're a child or an adult. In moderate scoliosis, it's between 25 and 40 degrees. And in this stage, if you're a child, they may recommend a Boston brace. If you're an adult, they recommend nothing. If you're having pain, it's more like pain treatment, but nothing for the curve itself to reduce the curve to make it smaller. The Boston brace is very only designed to try to hold the curve where it is. Once your curve breaks 40 degrees, now they say you have severe scoliosis, and at this stage is when they start recommending scoliosis fusion or scoliosis surgery, where they go in there with rods and screws and fuse the spine together. Very, very invasive treatment. The treatment that's going to alter your entire spinal integrity for the rest of your life, and there's very little data regarding the long-term effects. I also say there's a fourth category, and I call it very severe scoliosis, and this is 80 degrees or plus. And the reason why I have a fourth category there is because we have patients that don't do surgery, and they are looking around, they're looking around trying to find an option, and then they finally meet me, and unfortunately their curve is already over 80 degrees. And I've unfortunately treated patients in this category as well. In fact, the largest case I've ever seen in my clinic has been 155 degrees. So you can see double that number. So what does severe scoliosis look like? Well, first of all, number one is severe scoliosis is by specific degree of Cobb angle, meaning 40 degrees or greater. When we have 40 degrees or greater worth of a Cobb angle, normally there's very specific rotation associated in the scoliosis, meaning as a scoliosis bends, it also turns, and this rotation is always into the concavity of the scoliosis, meaning, so you can imagine the spine is bending, but it's also rotating into the concavity, meaning if the curve was like this, it would rotate this way, beating that side forward, this side backwards. And this rotation becomes more severe as the curve becomes larger. In fact, we believe that the rotation may be the initial deviation that occurs in scoliosis patients, but we don't really know. But that's what we actually believe. There are symptoms that are associated with severe scoliosis, and these are very often postural changes. You can see very severe postural changes. You don't need to even look very hard in most cases. You can see unlevel shoulders. We can see something called rib deviations. You can see ribs most oftenly on the left forward and on the right back, and that would be in the front and back. So you can see rib bumps in the back, rib bumping or arching in the back. We can see asymmetrical shoulder height. We can see asymmetrical waist lines. We can see asymmetrical hip heights. We can see also the head not being centered with the body below. It creates a lot of different postural changes. We can also see a lot of forward head posture. We can see a flat back syndrome. We can see arching or like a sway back occurs very often in severe scoliosis. Initially, when they start moving into adult stages, that starts to change where they can become hyperkyphotic with scoliosis as well, and their head begins to fall more forward. Okay. What are some other symptoms that are associated on postural differences? It can be headaches. We know that scoliosis can affect the nerves, so it can lead to headaches. It can cause pain at the site of curvature, but it can cause pain out into the extremities, pain down into the lower extremities. That pain can be also joint pain, but it can also be neurological, meaning causing nerve weakness and pain down into those each extremities. We know scoliosis, as it progresses, can lead to digestive concerns by either affecting the nerves themselves that control the digestive organs, by affecting the mobility of the spine, or actually affecting the distance or the room that the digestive organs have to function in, because as the curve progresses, it shortens that space. It can lead to sleep problems, meaning that your body can't relax or sleep well, irregular menstrual cycles, and as curves get larger, it can start affecting lung impairment. Now, let me talk a little bit about lung impairment because it's not really for sure. So we see some patients that at 40 degrees have no lung impairment, and other patients at 40 degrees do. So it's not actually just related to size of curve. There could be another impact. In fact, we see see some athletes, some very high-level Olympic athletes that have scoliosis and have higher functional lung abilities than an average person with no scoliosis. So it's not exact in terms of when we know scoliosis starts to affect the lungs. We start considering that at 80 plus, that it starts affecting lung impairment, but patients can still have a functional impairment, meaning they will never know because they can still develop most of their lung capacity. And since most patients don't use 100% of their lung capacity, they won't even know. When we start breaking 100 to 110 degrees, we start thinking the lung impact could be greater. But again, we really don't know because nobody has really studied all this out to do a long-term comparison. But as curves get bigger, they have a greater chance of affecting the lung tissue. So if you have severe scoliosis, what does that look like for you in terms of that's happening and what's that causing in your life? Where things can it be affecting? First thing, it tends to affect what you see. So we see a lot with kids, and we see a lot with adults that have a lot of problems with their aesthetics or in terms of what they're seeing, and they want to improve what they see posturally and improve their esteem in terms of changing that going on there. They're also more likely to experience pain as a result of their scoliosis. As curves get bigger and they become an adult, they have more experiences with pain. They also can have more experiences that affect their digestive and those are the things that we talked about. So if you have severe scoliosis, do you always have to have surgery? There's no other option. There are options. When it comes to traditional approach, the only option they really have for you is scoliosis surgery. So once you break 40 degrees, there's really one thing they offer is let's have a surgery. And of course, the surgery is to try to stop the curve from progressing, number one, but then secondarily is to try to reduce the curvature itself. There is another approach, and I call functional approach. The functional approach to scoliosis is to reduce the curve as well, but to reduce the curve by not reducing the spine's ability to work or function properly. And what do I mean by that? With scoliosis surgery, the spine is straighter, but at a great expense, meaning they're fusing the spine together with rods and screws. Your spine can no longer function the way it was supposed to. And yes, the spine may be straighter, but it can no longer bend. It's kind of like taking your elbow and fusing it together and say, yes, it's straight, but now your elbow doesn't work the way it's supposed to. You have a straight arm, but a non-functioning elbow. And that's exactly what happens with scoliosis surgery is, they fuse it, they make it straighter, but the spine doesn't work the way it was designed to work. So how can we reduce the curve and retrain function? And that is something I call a functional approach to scoliosis. And that's done with a very multimodal approach to help reduce the scoliosis while maintaining function. We treat patients with severe scoliosis, and we treat patients that have refused surgery and are never going to have it. And then we also treat patients to get their curve below surgical threshold because they are trying to avoid surgery. I have patients of mine that will never have surgery because they believe that the effects of the surgery are more negative than the effects of the scoliosis. And there's no data that suggests one thing or the other. We can't either argue one way or the other because we really don't know. We don't know the long-term effects of scoliosis surgery compared to patients who have never had surgery. So for some patients, they rather just deal with what they have and try to reduce their curve with the treatment options that we provide them in the clinic, meaning corrective chiropractic care, scoliosis-specific therapy and rehabilitation, scoliosis-specific home therapy and exercises, and maybe even scoliosis bracing. And all of these treatments are done to help try to reduce the curve and manage the curve within a range, even though we're not get them below surgical thresholds. Now, where's that cutoff point for me? I think curves around 60 to 70 degrees, or in that range, we have a very good chance at getting them very close to that surgical threshold, if not below it, because we know our average reduction is around a 30% reduction. Once we start breaking those curve size, it could vary depending on flexibility of the curve and age of the patient and how much reduction we can achieve. But then I have other patients say, well, it doesn't matter if I get 50 degrees or if I get 60 degrees or if I end up at 40 degrees, I'm still not having surgery. So we are still trying to reduce the curve and try to get them the best result possible. So if you have severe scoliosis or very severe scoliosis, what do I recommend? Well, first of all, obviously look into a surgical option, see if that's something for you. If it's not, then I definitely recommend that you do something to help manage your scoliosis over your life and not let it continue to progress. Reduce the curve and hold it within a range. meaning if you have an 80 degrees or 90-degree curve, let's say the best we can reduce your curve, just for example, let's say we hit stop somewhere around 65, holding it at 65 degrees is way better than letting it sit at 80 or 90 degrees. And then holding it at 65 and just managing that over your lifetime could be a successful management process for somebody with very severe scoliosis who utterly refuses surgery. It's better than doing absolutely nothing. However, if you're a case that's closer to surgical numbers, meaning 50 or 60, the goal could be different. It could be try to get you below surgical thresholds so you can totally negate the fact of you ever needing or wanting surgery, and we can get just as good results cosmetically and also retain the function of your spine. So whether you're in that very severe category or just barely over severe category, you always want to be looking at it, evaluating it, trying to reduce it so the effects of the scoliosis are lesser and not greater. Thanks for watching. I hope you found this information helpful. If you'd like to hear about other topics and information on scoliosis, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish content. Thanks.